Today we'll be looking at the benefits of the Trimwave by Trimbio. We're going to utilise H-wave therapy through the Trimwave on a patient with tension and pain within the thoracolumbar region of her back. Firstly, we will assess any areas of pain using palpation. This is done cranially to caudally, starting with a full assessment of the head, neck and shoulders, followed by palpation of the longissimus dorsi and epaxial muscles in the thoracic region. The lumbosacral and hindquarter regions are also assessed for any pain. Assessment is done bilaterally, and then a decision is made on where the electrodes should be placed to successfully treat the targeted muscles. You can visibly see the muscle tension through palpation. The muscle spasm that's visible on palpation of this area indicates pain and soreness, which can often result from overuse of the muscle. Muscle tension and spasms can often be painful if left untreated for a long period of time. When applying the electrodes, it is important to use a conductive gel to ensure the current passes directly from the electrode through to the targeted muscle. The current should pass through the muscle being treated and not cross the spine, so as you can see, the green channel A electrodes are being placed on the right side, whilst the blue channel B electrodes are administering their current on the left side. A frequency of 2 Hz for 7 minutes was utilised for these treatments, as this produces visible muscle contractions. The intensity of both channels is gradually increased until visible muscle contractions are present. As you can see, she's thoroughly enjoying her treatment. The intensity is only ever turned up to a level that is tolerable, and this is dependent on the horse. As you can see, both channels are turned up to a similar intensity. The first treatment targets the thoracic and lumbar epaxial muscles bilaterally. Using the Trimwave at lower frequencies initiates muscle stimulation, but higher frequencies create an analgesic effect. Muscle stimulation is essential here, as we want it to break down any adhesions within the muscles to reduce tone and improve the movement of these muscles. The second treatment targets the hindquarters. This treatment produced great movement through the thoracolumbar region heading into the gluteal muscles, which shows how much of an impact the Trimwave has on the muscles globally. Electrode placement for this treatment includes the gluteal muscles and the top of the hamstring muscles. This treatment produced great pelvic movement. The intensity is also similar for this treatment. The visible releases that the FEL displays are a great indicator that she's enjoying her treatment and also feeling the benefit of it. Releases include a lowered head carriage, licking and chewing, and a relaxed lip. The third and final treatment targets the thoracolumbar region whilst including the gluteal muscles. This treatment just provides extra relief on deeper muscles and areas that haven't fully been targeted by the first 2 treatments. Treatment with the Trimwave aims to reduce any tension and pain to allow the FEL to adjust back into her work routine without any deep muscle tension that may remain. Deep muscle tension within the back needs to be addressed, or it can result in issues further down the line, such as an unwillingness to move forward or other work difficulties. The main aim of this treatment was to significantly improve comfort levels. The Trimwave utilises H-wave therapy, which facilitates greater and deeper penetration into the tissue by using a lower current. The Trimwave has visibly reduced muscle tension and pain in the targeted muscles, as you can see through palpation. There is a greater bounce and soft feel to the muscles, especially those in the thoracolumbar region and through the gluteal muscles. The Trimwave has significantly reduced all muscle spasm and tension, which has resulted in no pain on palpation. Muscle stimulation with the Trimwave increases blood flow and venous return, which provides a healing effect with limited fatigue and discomfort to the horse. It also reduces edema by increasing lymphatic drainage to further reduce discomfort. There is a significant difference to the muscles following just a 20-minute treatment with the Trimwave. Following this session, the FEL can begin her training program again without starting with any underlying pain or issues that would have likely prevented her from performing at her best. Physiotherapy sessions utilising the Trimwave can prevent injury through the competition season. The Trimwave is an essential tool in reducing any muscle tension or any underlying muscle pain from previous competition seasons. Why not treat your horse to a session with the Trimwave?